So thank you all for coming. I appreciate you. We're going to talk a little bit about stress tonight. Okay? Nobody in here has stress, right?
No.
Okay, so stress is basically just a response to any stimuli, whether that's an emotional or physical event, and that can be even, imagined or a real situation. And our thoughts are a huge part of, our stress response. So, some of the examples, when there's too much stress on you, you lose sleep. Other things that can bring it about are just when you're taking your work home, or you're setting New Year's resolutions and not following through with them. How many remember their New Year's resolution? No idea what it was, right? Okay, so you get to the next year and you're like, okay, I'm going to set a goal this year, and it just fades by February for the most part. So 90% of the time, we create our own stress, and that's done by assigning meaning to things that don't matter. One of the examples I use is road rage. When you're driving down the street, people driving too slow, you get irritated and upset, and there's no need to. In reality, if you were going a little bit faster, you may get home a minute earlier. And that minute is not a huge deal in comparison to what that stress is doing to your body internally. It's causing a lot of problems, and so some of the causes of stress that I have down here are death of a loved one, whether it's a spouse or a grandparent or a child. Divorce or separation is another big one for people. That's an immense amount of stress. Illness, injury, anytime you're sick, that your body's under a state of stress, and it's just the sickness is showing a mechanism where your body cannot cope with whatever virus it's trying to attack. Another one is blurred purpose, not really sure what you're doing with your life or where you want to go. And one of the things I say to combat that is write down your goals. Have goals for what you want to do with life. Whether that's your job or personal, or for your kids, or any situation or area of your life that you have. You're not really sure what's going on. Sit down and write a goal. And even church is another example. If you want to get closer to God, sit down and write out a plan for reading the Bible. So overstudying is something I see a lot with students. Too much information. They just have overload, and we just got out of it, a year ago in school. It was pretty intense stuff. So that was constant stress for us. I have down trauma, toxins, and thoughts, and these are the 3 T's of stress. It can actually cause misalignments in your spine, and I'll talk more a little bit about that later. Okay, so chronic stress. There are different types of stress. There are chronic stress, and there is acute stress. Chronic stress is bad. It's terrible for your body. It affects every function, every cell in your body at a cellular level. So you have decreased immunity, increased sickness, fat storage, cancer, diabetes. These are all things that come with chronic stress on the body. So acute stress, on the other hand, is actually a good thing. It's that fight or flight response. So when you get out and exercise, that's acute stress on your body, right? You're putting your body through an immense amount of stress in a short period of time. Your body handles it and copes with it, and it actually produces good effects for you. So the chronic stress is that fight or flight response that keeps happening over and over without any fight or flight. Does that make sense? Mm-hmm. You keep having that response in your body. It's trying to continually fight off some type of stress, and you're not doing it. If you're not doing anything to get rid of that stress or that release, it takes a tremendous toll on your body. So when stress, like I have down here, when stress becomes chronic without physical exertion, the effects are globally detrimental on you. So I have another bullet point here with good stress. This is exercise that increases your happy hormones or your endorphins, and this can be done by running or walking. Just any type of exercise where you get out and just free your mind for a little bit. Cardio is great. Treadmill, bike. And I have down why exercise. That's to get that fight release, to get rid of that constant chronic stress condition that your body becomes used to over a period of time. You have to have a release to get that out. Healthy diet also allows proper function, and that occurs on a cellular level also. Bad stress increases fat storage, increases your heart rate, increases your blood pressure, and it increases your susceptibility to disease. If you constantly have stress, your body gets to a breaking point, and you have to deal with that somehow. So stress prevention, here's where I was talking about goal planning. Write them down, plan them out, and stick to them. That's the best way to go about it. Figure out what you want to do, just write it out. And when you write it down, you take on the task of preparing yourself to get out and accomplish those goals. You can think about it all day, but if you don't have a visualization of what you want to do, you never really get to where you're trying to go. So don't sweat the small stuff. That was another one. Just the road rage, like I mentioned earlier. You don't necessarily have to go through that. You control your thoughts. Breathing exercises. Another great one to control blood pressure is actually just taking in a deep breath, holding it for about 3 to 5 seconds, and then blowing it all out, holding that for about 3 to 5 seconds, and then repeating that three or four times. And you can do that throughout the day, and that actually lowers your blood pressure. Meditation is another one. It sounds kind of like, oh, meditation, it's that mystic type thing that people do, over in the Eastern world. No, but it's great for you, calming your mind. We think and think and think all day long. We don't allow ourselves to take a break. Sometimes you just need a mental break, and it's good to just sit there, relax for 10 minutes, and you don't have to do it perfect. There is no perfect meditation for people. You just relax your mind, and just let your thoughts kind of flow, let them go. You can read up on it if you want more, or I can get you more information. This is just kind of a short summary. So massage is another good one. Massage, actually massage therapists, when they're giving you the massage, are hitting acupuncture points all over your body, so although you may not realize it, you're actually taking a form of self-healing by getting a massage. So positive thinking and affirmations, like I said, we control what we think. I mean, you can get as stressed out as you want, but in the end, if you look back on those situations where you were super stressed, it didn't really do you any good, right? If you have a bad situation, just try to look at the positives. Think, how can I grow from this experience? What is God trying to teach me from this experience? And I bring up God a lot, but I think spiritual is another thing. Going to church and having some form of faith is another great stress reliever. Okay, so here are a few other things to cope. Acupuncture at home. You can massage your ears. And I talked a little bit about this in our last lecture. I did a home care acupressure lecture where I talked about different things that you can do at home from an acupuncture standpoint on yourself to treat common ailments, such as headaches and even back spasms, even boosting your immune system at home. So one of the things I talked about was actually rubbing your ears at night before you go to sleep. And this can be done in about 2 to 3 minutes. So what you're doing is there are little microsystems all over the body. The ears are one, the hand is another, feet, you've heard of reflexology. Okay, these are just microsystems of the body, and they're ways to treat yourself for conditions. So you can treat the entire body from the ear, whether it's organ problems such as the heart, lung. You can treat things such as smoking cessation, addiction, depression, bipolar. There's over 2,000 different things that acupuncture can help with, but rubbing your ears will actually release a euphoric response within your body. You're basically, like I said, you're treating yourself for any problem that you might be having inside. And the nice thing about acupuncture is that it can only help you, it can never hurt you. So if you can rub your ears and keep rubbing, and if you hit a part that doesn't necessarily need to be stimulated, it won't affect you at all. It's not gonna bother it, But if you hit a point that really, if you have a large intestine issue or a stomach problem, if you're fighting stomach ulcers and you rub this, at night before you go to bed, it not only helps you sleep better, but it's also hitting the stomach point will help, get rid of your stomach ulcers, or help your heart function better, or if you're really trying to quit smoking, we do things here, but doing this at home will also help that. Along with we treat a lot of infertility cases, and so if you're massaging all over, there are reproductive organs here. You have back points on the ear, so this helps this entire region. You know what I mean? So that's a great one, and it'll help you sleep better at night. So the last thing I kind of want to talk about is where chiropractic, the role chiropractic plays in this. So one example I use is if you drop a brick on your foot, you know, what is the first thing you have to do for healing to begin? That's right. Take the brick off your foot, right? Okay, so this is similar to a pinched nerve or pressure on a nerve. The first thing you have to do in order to begin healing that nerve is to take the bone off that nerve, right? You take the hard bone off the soft nerve. It's a simple concept, but a lot of people just don't realize the amount of stress that can cause on your body. You know, if your body's constantly trying to repair that area, that pinched nerve, you know, because anytime you have a pinched nerve, you have toxins and poisons released in the body because of that inflammation response. So a lot of people try to cover up with drugs, ibuprofen, pain relievers. None of that will correct a misalignment in your spine. You know, so what we do as chiropractors is make an adjustment to take the pressure off the nerve. And we see a lot of people that come back and they not only walk better, they don't have pain, but they also say, Doc, I feel great. You know, I've treated a multitude of different cases where you don't necessarily expect to hear that type of stuff, but people feel wonderful because their body's not having to fight and deal with all that that's going on in their body. And a lot of times it's not just one part of the body that has a misalignment. You know, we find multiple areas. If you have low back pain, a lot of these muscles attach, you know, to the upper mid-back region right here, or lower mid-back here. Okay, so a lot of low back problems actually stem from right in here. This area also controls your reproductive organs, your large intestine. You know, so if your large intestine's trying to function, or your reproductive organs are trying to function and they can't, you not only have that problem, you also have the pinched nerve, you also have the pain in your back, right? And I tell people, we don't treat pain. Pain is one of the last things to show up. The vertebra actually misalign 60% before pain even shows up, you know, and it's similar to cavities. You know, we go in and get cavities filled, you don't really feel those, right? So I try to get that point across to people. People come in and say, Doc, I'm so hurt. And a lot of times it's not an overnight situation. This is something that's been going on a long time. It takes time. It's similar to braces. You know, if you want your teeth straight, you put braces on, you don't have the dentist take them off the next day and say, all right, cool, my smile's ready to go. You know, it's just not, it doesn't work that way. So adjustments relieve nerve pressure and allow healing to occur at a cellular level. And so I tell people all the time, this is more than just pain. Your nervous system controls your entire body. You know, it controls your immune system. So we treat lots of kids also, you know, for not only ear infections, but common sickness. You know, and one of the things one of the great stories I love, I had a patient that was 19 months old. He came in with 102.8 temperature, and the mom said, you know, can you adjust my child or do something for him, you know? And I said, sure. So I adjusted him and worked 2 acupuncture points to kind of help his body balance out a little bit. And the kid's temperature dropped to 98.8 within 30 minutes. That's pretty cool, you know, and really I tell parents all the time, if your kids are taking aspirin to reduce that fever, it's actually impairing the child's immune response. It not only takes the immune response in a different pathway, it lowers the fever, right, which is just a symptom. You know, the fever is actually normal. It's telling you something's going on, the child's trying to fight it off. You know, so when you take that drug, it actually prevents other pathways of healing to occur. So this is the best alternative, you know, for all natural healthcare. You know, I think this is the best drug on the market, chiropractic. So it also increases, you know, the adjustments increase feelings of pleasure and relaxation, and just basically improve overall health. And so I guess my main point is that adjustments help you deal with stress, you know, on a cellular level. This is bigger than just an adjustment to take pressure off the nerve. You know, so I see people who have had a hard time sleeping for weeks and even years, and they say, Doc, I'm sleeping, but I'm sleeping through the night. This is awesome. You know, and that's a pretty cool deal. So anyway, that is my take on stress, and I hope you got some good information out of it. Does anybody have any questions?
I have a question about the ear massage. Okay, can you do that with like a Q-tip and work the Q-tip around?
Sure, okay. Absolutely.
Because I tried it, but it felt weird. So then I didn't know if I was getting all the different parts.
No, that's fine. You can use a Q-tip. Some of the bigger areas I would use
Okay.
hands and thumb or fingers. And
So are you
thumbs.
doing like the front and the back of the ear both, or
Yeah.
just the inside?
Yeah.
Oh, okay.
All the inside, front and back.
Okay.
Even
Okay.
even in through these grooves.
Concentrate on places that are rougher, have a scab there, something like that. That's just weird because a lot of times that associates. There was a patient that we worked an allergy point on the tip of the ear, and they said, "Is that why my top of my ear keeps itching?" Because their allergies were acting up. So people will notice that once in a while, in a place that if they do have indigestion or problems like that, they'll have like a little scab or a little rough area on the ear, and they go, "Oh, that's so weird. It's associated with that point." So kind of concentrate on that too. If you find something irregular, it's usually associated with some organ dysfunction there.
Okay. Thanks.
Great point.
Going home and getting the mirror out and checking out the ears. Okay.